Wanzer, and I am currently the manager of the Oncology Survivorship Program and Outcomes Manager at Great Lakes Cancer Care Collaborative. But prior to that, I was in higher education. I taught for almost 30 years. I started when I was 12. That's my joke. And I was a college professor. I taught courses in interpersonal communication, health communication, family, research methods, persuasion, and I also taught a course on humor. It was called Constructive Uses of Humor. And in that course, my students learned a lot of the things that you're going to hear about tonight. They learned about these things, but they also were able to do stand-up comedy. And so at the end of the semester, they could choose between a written final or they could do a stand-up comedy routine. And I would say the majority opted to do the stand-up comedy, and they were fantastic. And I think it was such a wonderful experience for them, building their confidence, and they had they were hilarious. So I'll talk a little bit about that tonight, about that experience, and you'll learn a little bit about how I trained them to do stand-up comedy. So the first thing that I want to talk about is the concept of coping, right? So what is coping? And, first of all, what is coping and why do we need it, right? We need coping skills, right? Something that we actively do, something that we actively engage in to manage difficult emotions, to manage difficult experiences that we have. We need that to survive, right? And especially in situations when we are unfortunately diagnosed with cancer or any serious illness. So one of the questions I always start out with is, what are some of the things that you do, right? What are some of the things that you do? And I'm used to doing this in kind of an interactive setting. So I'll kind of answer my own questions, right? What are some of the things that you do when life is difficult or stressful? So this is the question we'll start with, right? What do you do when you're really facing tough times, right? How do you manage that? And do you notice that some strategies or some of the things that you do are more effective than others? So typically when we talk about coping, right, managing difficult situations, something that we proactively do, people come up with things like, okay, I lean into my religion, my spirituality, my faith. I pray. I also, I engage in meditation or mindfulness. I tap into these strategies to help me deal with whatever I'm facing, right? To be more mindful, to be more in the moment. I exercise, right? I go out running, I go out walking. I find that movement helps me. I spend time with my family, right? With my friends. Pet therapy, right? I know that at Great Lakes we have therapy dogs that come in, and these dogs and visits with the dogs when people are having chemotherapy, they're really therapeutic. They love visiting with the dogs. The pets are a great source of comfort. Some people will utilize therapy, right? They'll go to a mental health counselor. Support groups, right? We know that support groups work. We talk to our individuals who utilize our support groups, and they find that it offers us a powerful sense of community, a place where everyone feels understood, that they can relate with their cancer experience. So we know that support groups work to help people. Sleep, sleep is really powerful. How do I cope? Some people say I take naps. I try to get good rest and sleep, sleep the appropriate number of hours. Hobbies, some people say, okay, I cope through knitting, crocheting, or some kind of hobby that they have that helps as a cathartic release. And we also know that, communication tactics, right? So I was a communication professor, so you're going to hear a lot about communication and communicating with others as a means of coping, managing difficult emotions, right? We know that sharing how you're feeling with others, kind of venting helps people. But the one thing that doesn't often come up, or it doesn't immediately come up when we talk about coping, is humor, right? And so that's one of the things that we're gonna focus on today, right? Is using humor as a powerful and effective coping strategy. Because we know that these coping strategies exist, right? Some of the healthy coping strategies that have been studied extensively. When we focus on our problems and we try to find a solution, right? That's healthy. Here is my problem. This is the difficult situation that I'm faced with. I'm going to try to find a solution for that, right? And try to fix the problem in some way. I'm going to deal with my emotions, right? Whatever those emotions are, I'm going to process them. I'm going to try to understand how I'm feeling, why I'm feeling that way, and I'm going to work through those emotions. Again, very healthy kind of what we call adaptive coping. Exercise, spending time outdoors, prayer and meditation, being around others. These are typically really healthy ways to cope, right? And then obviously some ways that we cope, right, are not healthy. And we really want to avoid engaging in these strategies or tactics, right? Like drinking alcohol excessively, overeating or binge eating, gambling, taking it out on others, right? Taking our frustrations, yelling at others, or taking things out on others. We know that's unhealthy. And one of the things we know is that we want to, when we're feeling, very stressed or facing adversity, we want to be surrounded by people, right? We want to have people around us who will help us get through that difficult time. So obviously, expressing anger or lashing out at someone is not going to be beneficial, right? Engaging in risky behavior, rumination, kind of just ruminating over and over, not letting things go is unhealthy. Overspending, people talk about retail therapy, spending too much money and, uh, driving up our credit cards and then having to pay that later. These are kind of unhealthy things. But again, something that doesn't naturally, get discussed is this idea of humor, right? And using humor as a mechanism or as a method to help you get through difficult times is something that can really help have a cathartic effect, can lower your cortisol levels, and can actually help you, right? With your relationships as well, right? That people like to be around individuals who use humor. They like to, spend time and talk with them and things like this. So I'm going to talk about using humor, right, as a coping strategy. And again, this is something that I'll share my bias in a minute. But, my first question is, do you use humor to cope with stress, right? Do you ever find yourself, think about what the title is, right? If I didn't laugh, I'd cry, right? That you find yourself making a joke about something, right? Because that's the only way you can respond at that moment. And again, I want to reiterate that there are a lot of different really effective coping strategies that I mentioned earlier that are effective. They help to lower your stress. They help to change your mood. And sometimes with difficult situations, we have to throw everything at it. So this particular lecture is going to focus on communication of humor, right? Because that's different than sense of humor, right? And I'm going to be very clear about that. As a former communication professor, sense of humor is your appreciation, and that's important too, right? Being able to find humor and see humor, that's really helpful. But alongside that is our ability to communicate humor, to produce humor. And that's what I want to focus on tonight is producing that humor as a means of helping you lower your stress. Does humor help? Is laughter the best medicine? This is kind of funny. I don't know if you know Jim Gaffigan. He's a stand-up comic, and his wife, unfortunately, was diagnosed with a brain tumor. And he talks about his experience with his wife and her cancer. And he says, is laughter the best medicine? He's like, absolutely not. Medicine is the best medicine, right? But this is kind of that old saying of, right, is laughter the best medicine? Can it help us, right? And again, this is what we're going to focus on tonight. So here's my bias. I obviously use other coping strategies, right? My spirituality, exercise, mental health professionals to help deal with stress and adversity. But I also consider humor, right? My ability to produce humor, to appreciate humor, I consider it a friend, right? A very valued coping strategy. I regularly use humor to cope. I was diagnosed with breast cancer in 2017. I had the opportunity to test how effective humorous coping was through a really dark and difficult situation. I know that it helped me. I know that it also helped people around me who were very uncomfortable with sometimes because it's a difficult topic to discuss, right? So I made jokes and made fun sometimes just to facilitate communication. Again, my bias also comes that I've done a lot of research on humor, and that's where you're going to hear, you're going to hear about some of this research, right? That studying humor is really important. Understanding how and why humor works to help us get through difficult situations, help us feel more self-efficacious. I taught a class on humor where my students did stand-up comedy. It was one of the most rewarding experiences of my teaching career to watch students stand in front of a group of other students, right? And perform something that they had never done before, that they felt very uncomfortable doing, and basically kill it, right? They were hilarious and they did a great job. And I think that that experience, taking a risk, putting themselves out there and learning that, yeah, you can be funny and you can be appropriately funny, right? Not offend people, not use any humor that's inappropriate. But I do realize that humor is not for everyone, right? That some people feel uncomfortable communicating humor. They feel that's too risky, or they just don't feel that they have that skill. And that's what I want to talk about, is that there are other ways to appreciate, to see humor, to find humor. Put yourself, find someone that you find is funny, right? And talk to that person. And I'll share some stories that were shared with me from the healthcare field. So I'm going to talk about a communication-based personality trait called humor orientation, right? And I'm going to talk a little bit about this communication-based trait because I studied it extensively for quite a few years, and how this communication-based trait is beneficial, right? And I'm going to show you in a minute how it's measured, and talk a little bit about how your propensity to use humor, right, to produce humor, right, can be beneficial for you and for others. And then I want to talk a little bit about how to go about incorporating humor in your life, right? Finding humor, tracking it, sharing it with others, and how it can maybe help you manage your stress and improve your well-being. So this is the humor orientation scale. So the humor orientation scale, this is a short version of it, right? But one of the things that we did, my colleagues and I, is we looked at, again, this communication-based trait, which is different. It's correlated with sense of humor, right? So someone who is humor-oriented also has a sense of humor, right? They report greater appreciation of humor. But it is a little bit different, right? So the humor orientation scale is an 18-item scale, Likert type scale, and it measures the extent to which you use humor, how often, right? How often do you use it? And then also, how effective do you think you are? Do you think that when you use humor, you're funny, right? That it works? And so this is a scale, and as I said, I'm happy to share anything that you see tonight or anything you're interested in. This is a shorter version of the scale, right? And I traditionally, when I do or any of these lectures, I hand it out and we talk about your humor orientation score. So if you, for example, scored, if you say 5 to all of these, strongly agree, right? Then you have a score of 20, right? So that's a higher humor orientation. And we say that you're a high ho. Get it? Humor oriented. And then if you don't regularly use humor, right? You don't think humor is something that's natural, right? You score 1s on all of these. You have a very low score, and you're a low humor oriented person. You might appreciate humor, but you don't produce humor, right? And then somewhere in the middle is a lot of us, right? A lot of people score in the middle, and that is that sometimes we use humor and sometimes we don't. But one of the things that we know about this trait is that it does benefit the producer. That producing humor helps people who produce humor, who use humor, do cope better with stress because they have this kind of built-in, right? They have this kind of built-in trait or tendency that they know when they're feeling stressed, and they kind of treat that stress or treat that emotion with humor. So, for example, when I was when you're diagnosed, and some of you might remember this, when you're first diagnosed with breast cancer or with any cancer, you're going to be going through a lot of diagnostic testing because they're trying to figure out, has the cancer spread? How serious is this? And so I know that I was feeling very anxious, very upset. And so I was making jokes a lot, right? And that's a very classic kind of tendency for someone who scores higher in humor orientation, because that use of humor helps to manage that stress and manage that anxiety. Now, I also have this fun little another way that this is not a humor orientation scale, but this is something that I historically have done when I do these workshops, is we talk about, okay, well, what are some other ways to assess humor, right? And humor production or humor comprehension. And this is kind of a fun exercise because this is really getting at joke memory, right? So, because I think jokes are like one way to be funny. It's not the only way that we're funny, but they're one way to be funny. But one thing that we used to do in class, right, is talk about jokes and joke structure, right? Have the jab line, the punch line. You have this very specific structure. So, I put these up here just because we go through these and talk about joke completion, right? This is one way. People who have a greater tendency to use humor are able to complete these jokes. A beggar told me he hadn't had a bite in a day, so I bit him, right? Waiter, there is a fly in my soup, right? And some of these are kind of old. My students really struggled with them because this is an older measure. Take a long walk down a short plank. My mind is made up, so don't confuse me with the facts. The only time that a bank will loan you money is when you don't need it. Where does a 3-ton gorilla sit at the movies? Anywhere he wants. Carrots must be good for eyesight. I never saw, right, that a rabbit with glasses. Or so, there are a number of different ways to assess, to measure people's tendency or understanding of humor. And this is another kind of fun one that I historically share when I do these workshops. So how does humor production, right? How does producing the humor benefit you or benefit individuals from an intrapersonal, right? So how does it benefit me kind of internally? And then how does it benefit me from a relational perspective, right? So as I said, a consistent finding was that people who used humor, right, who used humor regularly, that they reported greater coping efficacy. They felt like their humor coping strategies worked. Like when they did use humor, they felt better. They felt less stress. They had that kind of shift from a negative affect or negative emotion to a more positive emotion. And interestingly, we found that for nurses, for employed individuals, and for aging adults who are more humor-oriented, they report greater coping efficacy, so that that this is a good coping strategy. It works. And that leads to higher job satisfaction and higher life satisfaction. So again, this kind of built-in communication tactic that can help you manage adversity and manage stress. From an interpersonal perspective, we found that humor-oriented people are perceived as more socially attractive. So think about the people that you're friends with or your spouse, right? That we are attracted to people that we find funny. And that's important, right? That we have the same sense of humor as us, or that get our sense of humor. This was some interesting stuff too that we found. We didn't do this research, but this is not real surprising, right? The physicians who use humor are less likely to be sued. And, what it is it's liking, right? That you are less likely to sue someone. It's not that these physicians are Seinfeld or hysterically funny. It's just that we appreciate that physician's use of humor and we like them more. So we're probably less likely to sue them. I remember a few years back reviewing an article that showed that patients that use humor were more well liked by their providers. And again, that use of humor maybe makes it easier to talk to the patient, to relate to the patient, as opposed to a patient who's angry or agitated or nervous. And we know that humor is a valued relationship building strategy. So the other way to talk about your humor use, is, through talking about these different styles, right? These different styles of humor. So when you communicate humor, you tend to exhibit one of these four different styles. So think about your own use of humor. When you communicate humor to someone, is your predominant style affiliative? Right. And what does it mean, to use affiliative humor? So someone who exhibits an affiliative humor style is really going to try to make people feel better, right? And feel maybe included through their use of humor. So if you see someone trip, you might say, "Oh, that's okay. That I saw that ground move, or I saw that step shift." Right? But you're going to try to make them feel better. You're going to try to use humor, a humorous quip, to make that person feel differently. Self-enhancing humor, again, another strategy, is you're going to use humor then, instead of making others feel better, to make yourself feel better, right? So you're going to make a joke maybe about yourself or about the situation that's going to make you feel better, right? And again, I saw a T-shirt a long time ago like that said something like my breast tried, my breast tried to kill me. Okay, but again, making jokes about yourself, and that's through those jokes about yourself, you feel better. Self-defeating humor, and I don't know if anyone remembers this comedian, but this is that kind of Rodney Dangerfield humor, right? So Rodney Dangerfield used a lot of self-defeating humor, a lot of humor that was targeting himself and making himself, kind of making yourself the butt of the joke all the time. This would be like, I was such an ugly baby that the doctor slapped my mother, right? Or something like this. Or again, that very Rodney Dangerfield, very targeting yourself, making yourself the butt of the joke. And then aggressive humor would be targeting others, so why is your head the size of a pumpkin? Again, very aggressive humor style. Obviously, affiliative and self-enhancing humor styles are more positive. People who use that kind of humor have better mental health, better relationships. They utilize that style of humor to enhance relationships and to improve their well-being, their mental health. So, this is a way to kind of understand or frame your humor, right? Do you use humor often? Are you effective at it, right? That's a humor orientation. And then, qualitative differences in how you use humor. When you use it, do you try to make others feel better? Do you use it to make yourself feel better, to kind of lift yourself up, or to manage difficult situations? Do you put yourself down all the time, or do you put others down? So those are qualitative differences. So when we talk about using humor, right, and understanding humor, the big $1 million question is why do we find something funny, right? So when I taught this class on humor, that was a consistent thing that we talked about, like what makes something really funny. And these three theories kind of explain it all, right? They do a great job of explaining why we find some things funny and other things not, right? So this is kind of the big three, in understanding humor. So the first theory is called superiority theory. And really, this just is that we find things funny, when it makes fun of our enemies, right? We kind of find things funny when we can laugh, right? And this is a little bit of a more aggressive type of humor, right? That humor is a game, and there are winners and losers. But when we can laugh at misfortunes of others, we can maybe feel better about ourselves, right? So, when we make fun of the Miami Dolphins, right? Because we're Bills fans, right? Squish, what is it? Squish the fish, right? So, when we make fun of, toilet paper hoarders, right? People who were hoarding all that toilet paper, right, during COVID, that's a relatively benign thing to make fun of. So humor is a kind of a game, right? It's a game, and there are winners and there are losers. But this also explains why we make fun of ourselves too, to a certain extent, right? Like if I can make fun of myself, then maybe I feel like in control, right? I feel in control of a situation. So, I think that one of the things that might happen is when you're sick, when you're not feeling well, right? When, you're going through something difficult, like a cancer diagnosis, right? You might say something like, I have chemo brain, right? You make fun of yourself. And the idea is that if you can make fun of yourself, well, you can control that situation or that circumstance. So, I was often saying, chemo brain. Now, I don't know if any of you still use chemo brain, but apparently there's an expiration date that I have heard occurs that you have a certain amount of time to use it and then you can't use it anymore. Or stupid cancer made me do this, right? Or joking around again, making fun at your own expense. But the idea is that if I can find it funny, then I can control it or manage it. So the other way that we find things funny is if it's shocking, right? It's shocking, it's unexpected. We didn't expect to see a dog delivering a UPS box. I think that a lot of what we find funny, right, and about 30% of ads use humor. A lot of this is incongruity, right? Putting two things together that don't belong together, right? So a dog in a UPS costume, a dog carrying, and delivering a box. I mean, what's funnier than dogs in clothes, right? So incongruity resolution theory is another theory that explains why we find something funny. And as long as we can make sense of it, right, as long as we can look at it and say, oh, okay, it's a dog, it's wearing then we can find it funny. If we can't make sense of it, right, if two things are put together, and it's unexpected, but we don't understand it, then it's probably not funny, right? It's probably not funny. So the humor has to be the incongruity, the two things put together has to be resolved, right? In some way it has to make sense to us. My husband and I were watching a commercial and we were talking about it and how we couldn't figure out, it was supposed to be using humor, right? But we had two very different interpretations of the message, right? So it was incongruity, right? But it was never resolved. So we didn't find the humor in it. And I'm sure that's happened at some point where you're watching something and, there's two things together, but they don't fit and it doesn't make sense. And so you don't get the humor, right? That's the times when we don't get it. So this is really important. I think this theory, this relief, this cathartic relief, right, really explains why I think for a lot of people, why after you laugh, after you have a really good, like cathartic laugh, right, you feel better. You just feel better. And historically, when I have done this in person, right, we do this exercise where we just laugh for like a minute. And, just even a fake laugh, even being told, hey, laugh, right? People feel better. They report that they feel, they can feel their blood pressure go down, or, they feel that kind of cathartic release. And this is actually a study on looking at this particular study was on exposure, looking at the link between stress and humorous response. And basically what it's showing that the funnier, if people found something funny, or the funnier they found it, the lower their stress got, the stronger their humor response was. So they were exposed to some humorous stimuli, and the funnier they saw it, the more that their humorous response, their mirth response, the more powerful it was, the lower their stress. And that makes sense, right? When you see something that really makes you laugh, it's really funny, you feel better than watching something that's moderately funny or mildly funny. So having that great cathartic laugh, right? Seeing something that really resonates with you can lower your stress, right? Lower your stress level. So this is a great argument for watching funny movies, watching stand-up comedy, exposing yourself to humor when you're in a difficult or stressful situation to help lower those cortisol levels and to help you feel less stressed or anxious. So, this is the thing. People will come up to me after this lecture and they'll say, but what if I'm not humor oriented, right? And the students would do that in my humor class, but I'm not funny, right? What do I do? Can I still have the benefit from the benefits that you're talking about, right? And I say, absolutely, right? Absolutely. We know that higher humor-oriented people just have that tendency, right, to use humor. They're kind of predisposed in a sense to use it. But people who score low and even moderate can still utilize humor, right? They can still tap into humor, find humor, replicate or mimic humor, and reap the benefits. So one of the things that we found that's really important is to use humor that's appropriate, right? And that wonderful book, fantastic book, if you have any interest, is this book by Jennifer Aker and Naomi Bagdonis called Humor Seriously, Why Humor is a Secret Weapon in Business and Life. They offer a humor class. I think it's in their MBA program that is incredibly popular, but again, focusing on humor in business and how humor can aid in creativity and all the other things we're talking about, relationship building. But they repeatedly emphasize using humor that's appropriate, and I brought that up with my students numerous times when we would talk about comedians and saying that, there are comedians out there who do not use a lot. They don't use any swearing. They don't use any sexual content, or they don't go blue. I think that's the term, right? Like they're not raunchy, and they're able to be incredibly effective, right? Jim Gaffigan is one, Ellen DeGeneres, there are a number, Nate Bargatze, there are a number of people who can be funny, right, without having to be inappropriate. So we talk about, people appreciate the effort. And one of my favorite stories from teaching was in our grad program, a student talked about she had a boss that sent out a joke of the day every day. Every single day he sent out a joke of the day. And the jokes were incredibly corny because this is HR, this is human resources. They were incredibly corny. And but this was his ritual, right? And people would pass them around to each other, haha. And one day he forgot to send out the joke. And people would make fun of these corny jokes, like amongst themselves. They'd be like, oh, did you see the one that, Bob sent out today? And one day he forgot to send out the joke. And the students said they got more calls and complaints in their department that day than they'd ever received about anything. That, where's the joke? How could he not send it out? We depend on that joke. And so the joke has to be appropriate, right? Though that's important. Some of my students have been in job interviews and they've been asked to tell jokes, right? The interviewers stopped them and said, hey, tell a joke. As long as that joke is appropriate, right? The effort and the kind of quick, think on your feet, right? That's appreciated. So I always say, why did the Cyclops quit teaching? He only had one pupil. The other thing I talk about is writing in a journal, right? Writing in the students were required to keep and I would encourage you to do this, a funny find where they just write down funny things that they saw in the news or funny things that they saw at work. But they kind of just document these little, little comedic moments in their life, and then go back and read about them or share them, which I'll talk about in a second. But humor is something that is social. It's something that we share with each other, and so it's okay for you to hear something or hear a joke or and repeat that in another context to kind of steal it. I think that hey, I heard something funny today. People are excited. Okay, what'd you hear? Or, something funny happened. And again, others will appreciate that effort that you put in to share that humorous moment, to add some levity. So to find the funny, I talk about this advice again, which I think is really great advice, is really paying attention to what really, really makes you laugh. What is it that you find hilarious, right? And start kind of thinking about that in a different way, right? Noticing what really makes you laugh will probably help you to understand what other people will find funny and what will make them laugh. And this is important, right? So kind of do this like mini analysis of, what really is funny to me, what really makes me laugh. So this is an exercise that this is an actual stand-up comedy exercise when my students are going through the training. This is one that we use. And so what I would say for you to do, this would be something that they would write in their funny find, right? They keep a funny find journal, and they would put a list of just everyday objects, right? Tupperware, masks, dog clothes, whatever, socks, shoelaces, whatever. And then beside that object, you would put an emotion, right? So, Tupperware. When you think of Tupperware, what emotion, what response do you have? Right? Is it anger? Is it frustration? Is it happy? Maple syrup. What's your reaction? Like, can you think of an emotion that you would connect to maple syrup, right? Spam, and I have a picture of spam. I don't know how many of you have ever had spam, but what is your reaction to spam? Is it, disgust? Is it excitement? Is it joy? Right? And then people would, we would do this exercise, right? And then you would come up with a story, right? You would come up with a story. So, you would say maple syrup, frustrated, right? And then you tell a story around why maple syrup makes you feel so frustrated, right? Is it because no matter how careful you are, you always spill it, it's sticky, and everything then sticks to you all day, no matter how many times you wash your hands. And again, you kind of work and develop that story, and you start exaggerating, right? That maple syrup is like super glue that you can that you put on pancakes, and that, kind of tap into too the ridiculousness, right? So students would do this, right? My students would do this, and I'd encourage you, right? Because I think, all right, how do you find your funny? Where do you go with this, right? This is an exercise that I would say, okay, try this, right? Try this. And practice. So like I show this picture, right? We spent one whole class period talking about Tupperware and how Tupperware makes, it was like Tupperware anxious. And the whole class, everyone had a Tupperware story. Every single student would talk about how their Tupperware, you finally load all your food in there and you can't find the lid, or you finally, get to the point where you're ready to, put everything into the cupboard and you're missing one lid, or one lid won't fit on, or you finally go and you make that effort to put all your Tupperware away, and then one day later, your kids go in there to get a dish and the whole thing is trashed again, right? So Tupperware, conversations around something really mundane, can be really fun and silly and goofy. And again, there's that social piece where when you do it together, you start feeding off of each other, right? You start feeding off each other, and we've had so many funny conversations around Tupperware. So and part of the reason it's so funny is because there's so much truth in it, right? So one of the things that we know about stuff that's really funny or that resonates is that there's some truth to it, right? And think about if you ever watch Seinfeld, and we talk a lot about that show because there's so much truth in it, right? That it really was a show about nothing, but it was it was relatable, right? Like everybody knows a close talker or a quiet talker. Everyone knows somebody, right? Like, has an experience with a puffy shirt, or, something silly, again, that we can all relate to. But really that isn't that outlandish or spectacular. It's just normal everyday things. So the advice is like, look at the world around you, right? Ask yourself, questions about things that you see, or even your own behavior, right? And like, why do we wash our dishes so much before we put them in the dishwasher? Or why, when we go to the doctors, do we really go to great lengths to hide our undergarments, right? Within our clothes. I saw a whole comedian talk about this, and things that we do kind of reflect on our own behavior. And as far as using humor to cope with something like cancer, right? I mention this repeatedly, right? That for myself, I tapped into my normal, kind of my natural tendency to use humor, right? And I studied myself, and I did find myself using it and cracking jokes and trying to be silly and goofy, because that was what I needed to help me get through it. Again, not everybody is like that. And did I feel better? Yes, I did. And many times I thought, if I don't laugh and try to make a joke about this, I'm going to cry. And I don't want to cry right now, right? I want to kind of get through this and then maybe cry later, right? But I do think that utilizing humor with, with others, right, is a way to connect. Affiliative humor, we know, is a positive humor style. Saying to a fellow chemo patient, hey, we both have the same hairstyle. We both have the same cool hairstyle, as a way to connect, right? Again, making sure, obviously, that person is in the same experience and going through the same thing. But, hey, look, we have the same cool hairstyle, and you're joking around with each other, among each other, self-enhancing, using humor to kind of, cope or manage that difficult situation that you're faced with. And I remember always saying, like, well, I don't have to buy any hair products right now, right? I don't have any hair. I don't have to spend a lot of money at the hairdresser. There's another $200 that I can spend on cheese, or something else. And I think also, like, finding, tapping into your weird and your strange aspect of yourself, like what's absurd or what's silly or weird to you, and thinking about that. This is one of the examples. Why is my drying rack made out of Tinker Toys? You ever think about that? Like these drying racks, you like put one thing on them and they just fall to the ground. Why is that? Why are they sold when they're so flimsy and useless? But finding humor in that, right? Instead of frustration or anger, finding humor and joy and strangeness in that. The other thing that I'll just point out is that timing, right? And timing is important. Too soon jokes. I'm sure you've heard of that comment. Like, it's too soon to make a joke about certain events or circumstances. And I think that as someone who used a lot of humor throughout my, whatever, 18 months or so that I was going through things, that sometimes I would make jokes about death and especially around my daughters, like, I joke about it, and that was probably too soon. Right. So there was an example, I think, in retrospect, that I was using humor, maybe too soon into my diagnosis or into that experience. So kind of reading the room and assessing when is a good or bad time to use it. So this is my suggestion, right, as far as how to incorporate humor into your life, right? How to tap into something that you might naturally appreciate and might naturally use. I think that first I would say be comfortable taking a risk and producing humor, right? It can be silly. People they really appreciate the effort as long as it's appropriate, right? As long as you steer clear of making jokes that are racist, sexist, homophobic, or can isolate any particular group, right? Making jokes about, why did the Cyclops quit teaching? He only had one pupil. Making jokes about, again, benign jokes about yourself, or things that you observe. Those are all, healthy. Those are healthy ways to use humor. I say to people, sit and watch comedy. Watch Jim Gaffigan, watch some of these comedians, and kind of repeat some of the things that they share, right? Jim Gaffigan is notorious for just observations about holidays and food. He talks a lot about food, his family, but try to find this humor and then just reproduce it, share it. Oh, I was watching this comedian and this comedian said this. I was watching a comedian the other night, and they were talking about how women, and sometimes, not all women, but overthink, right? That you're sitting there and you're thinking, oh, I should do this and I should call her, and why didn't I do this and why did I do that, and just this kind of downward spiral. Repeat that with your friends, share a laugh, keep a funny fine journal, write down things that you find funny. And this is what my students did. And I think at first they thought I was crazy, that I kept saying, like, you're going to do stand-up comedy and you're going to be funny. And I knew that because I had taught the course like 5 or 6 times already. Everybody did a really good job. We prepared for that stand-up comedy. We've spent a lot of time with that. So, but I found it really cathartic myself to write down funny things, rather than focusing on maybe all the bad things that are happening in the world, right? Sit down and try to search for things that you found humorous or silly. There is that one study that is kind of, it's a little not incredibly accurate, but it talks about how little kids laugh, X number of times, hundreds of times a day. And then adults, as we get older, it's like we laugh 3 times in a month or something. And again, I'm exaggerating. But the basic gist of it is that the amount that we laugh starts to dramatically decline, right, as we age. And so bringing rebirth, bringing that humor back into your life somehow, by watching comedy, by finding old funny movies, by reading funny blogs, or looking for funny memes, keeping that journal, writing it down, and then sharing, right? And then taking that humor and sharing it with somebody and looking at that as like almost a gift, like I'm giving you the gift of laughter, right? Imagine what the world would be like if there was, less complaining and more effort with humor and sharing humor. And in particular, sharing humor that's appropriate, right? That, we're putting in that effort to share humor that is, relatable, that is based on, your experiences or your observations, and that it's very likely, since we're all humans, that we probably share in that experience, right? We share in that experience with washing our dishes off before we put them in the dishwasher, or burying our undergarments, right? Anytime we go to visit our physicians or healthcare providers. So that is everything. That is my presentation, my kind of push, right, for everybody to use humor and find humor. And I hope that it has been helpful and that there are some great takeaways. And also feel free, like I said, to reach out to me about anything that I shared tonight, the slides, any of the measures, exercises, any of that. So thanks for joining in.
Awesome. Thank you so much, Melissa. It was a really interesting presentation. I love the memes that you used.
Thank you. Thanks. Yeah, I'll tell you, one of the things I didn't say is people expect when you research humor and you lecture on humor that I expect you to be funny, and I always start out by saying lower your expectations. So if I'm funny at all, then that's great.
Absolutely. Does anyone have any questions? If you do, feel free to put them in the chat box, and then I can get those to Melissa and we can answer those. Okay.
Thanks for coming again, and feel free, like I said, to reach out to me. I'm just gonna put my email. Yes, I absolutely will share copies of the slides.
Yes, yeah, Linda asked if we could get copies of the slides. We can
Yes,
send those out.
yes. Go home and start your funny find tonight.
All right, everyone. Thank you so much for joining, and have a good rest of the night and the week.
Yes, thanks for coming. Take care.
Bye-bye.